Morning, good evening, good afternoon. This is Dr. Garais for MED104 Medical Terminology. And now we are on chapter 9. So we're going to go here, go in our modules, find the lecture, and it should be 1, 2, 3, 4, 5, 6, 7, 8, 9, which is the cardiovascular system. So the cardiovascular system, so it's not only heart, but the vasculature. And so if you are a cardiovascular surgeon, you are not only can do surgery on the heart, but the vasculature, which are arteries and veins and capillaries, the tubing or blood vessels. Cardiology, we already know. Blood vessels, vasculature or vascular, AR pertaining to the blood vessels. And we have three types: arteries, veins, and capillaries. Arteries typically go away from the heart. They're colored red in the textbook. Artery veins are colored blue. They typically come back to the heart. And what's in between arteries and veins are your capillaries. Now remember, they are not colored red and blue in real life. Those are just conventions in textbooks, so we know what they are. You have chambers or four rooms of your heart. Two small ones on the top are called your atria, plural. A single atrium, so you have a left and a right. And ventricles are the large rooms or chambers in the heart, and that's in the lower part. So you have two atria, two ventricles. You also have valves. Your AV valves are called tricuspids and mitral valves. The one on the right is called the tricuspid. The one on the left is called your mitral valve. You also have these other valves that come out of your, that enter your aorta, which is in your, exiting your left ventricle and entering your pulmonary trunk, also known as your pulmonary artery, coming out of your right ventricle. So pulmonary valve pertaining to ARI, pertaining to lung, and the aortic valve pertaining to the aorta, which is the largest artery in your body. Valvulotomy, tomy, I'm going to cut into the valve. I might have valvulitis, I mean. Atrium or atrial, pertaining to the atrium or the lower, the smaller chambers of your heart. Atrial and ventricular fibrillation is not a good thing. The heart is supposed to contract in a organized manner, and fibrillations is disorganization of that, and also called an arrhythmia, which we're going to look at that word momentarily. You have your septum, pertaining to, or means a structure of. Septum is simply the structure that cuts your heart into a left, or separates your heart into a left and a right. And if you had an atrial septal defect, that means the thing in between the left atrium and the right atrium is defective, or there's a hole in your heart. You could have VSD, which is ventral or ventricular septal defect. Septoplasty is something that we have to do to fix the defect or repair the defect. Ventriculotomy, tomy, I'm cutting into my ventricles. Cardiac arrest, that's when you have also what is known as asystole. It is when your heart doesn't beat for more than 6 seconds, and that's not a good thing. Myocarditis, inflammation, and infection of the muscle of my heart. Your coronary arteries and veins, or your coronary vasculature, are the arteries and veins that surround your heart, and you could easily get a coronary thrombosis. Most common place to have it is your left anterior descending artery, which is, I think, anywhere from 40 to 60% of all AMI, or acute myocardial infarctions. Pulmonary means pertaining to your lungs. Systemic means pertaining to, of course, your system, your whole entire body. You have arteries, veins, and capillaries, which I mentioned before, and they are part of your vasculature. And your vasculature could either be angio, vaso, or vascular. So angioplasty is a procedure of repairing my blood vessels. Angiogram is the actual recording of it. Vasodilator will make my blood vessels like more open, like the tubing will be opened up, and vasculitis, inflammation, infection of my vasculature. You can even have stones, but not very common. But what's more common is aortitis. Arteriosclerosis versus stenosis. Remember, sclerosis is hardening of the arteries. Arteriostenosis is the lumen or the hole starts closing up. They sound alike, but they cause the same thing: high blood pressure and emboli and problems. But they're two different things for medical terminology. Endarterectomy, right, is of course endo, within the what, artery, and I'm going to cut it out. Cut out the inside of my artery. Oh, excuse me. Now, athero is different than arterial. Arterial means artery, but athero means fatty plaque. And fat is long standing in your body. It turns into it calcifies and gets hardened, and hence the term sclerosis, abnormal condition of hardening of that fatty plaque, and that's a really bad thing. Phlebotomy, Tomy, we already learned about phlebotomy, and venipuncture means the same thing. Lovely, both A and B question. Angina pectoris, that's pain associated, or chest pain associated with your heart. Arrhythmia or dysrhythmias, remember the S1, S2, they have to go, they lub dub, lub dub, lub dub. Your heart has to be rhythmic. And when it gets out of hand, either tachycardia or bradycardia or asystole or any one of the number of dysrhythmias or arrhythmias. Palpitation is also considered a dysrhythmia, arrhythmia, because you're not really supposed to be so tensed out that you can actually feel your heart beating, right? When that happens, you're either in a severe situation or you have some sort of heart disease. Pectoralgia, remember your pectoralis muscles are in your chest, related to chest pains, hence the term angina pectoris. Diaphoresis, state of condition of complete or thorough sweating. It's like hyperhidrosis. Hemorrhage, phlebalgia, you know that. Echocardiogram looks like an electrocardiogram, right? But they're two entirely different things. Echo or 2D echo means it's an ultrasound. An electrocardiogram is something else. It's when we put the electrodes or the stickies, little stickers on your chest and your arms and your legs to find to record the electricity of your heart. Okay. Endocardium, epicardium, myocardium, pericardium. Use your medical terminology powers when you are in anatomy and physiology, because there's a lot of layer questions in anatomy and physiology. Endo means inside, epi means right on top of, myo means middle or muscular layer, and peri means surrounding all of the above. So you got your pericardium, myocardium, epicardium, and endocardium. I could ask stuff like, which one goes first? Which one goes last? Based on your knowledge of medical terminology. Cardiomegaly, bradycardia, tachycardia, we already went through. Cardiotoxic, it's any medication or substance that is poisonous to your heart. Cyanosis, osis, abnormal condition of cyan or blue, and when someone turns blue or ashen colored. Murmur, of course, are extra sounds. You only shouldn't hear lub dub, lub dub, lub dub when your heart is beating, or when you're listening to through a stethoscope. When you start hearing other extra things other than the S1 and S2 or the lub or the dub, then that's a murmur. That's a problem. Sometimes the murmurs are pathologic. Sometimes they're just part of old age. Superior and inferior vena cava. Vena means what? It's venous. So it's a vein. So you have one coming from your head, that's the superior, one coming from the rest of your body, and that's your inferior vena cava. Both, as a point of trivia, empty out into your right atrium. And everything on the right side is part of your pulmonary circulation. Angiogenesis, creation of what? blood vessels. Angiopoiesis, creation of or formation of blood vessels. Angiolith, I have a stone in my blood vessels. Angiosclerosis, I have hardening of my blood vessels. Occlusion means I'm totally cutting off that blood vessel. That means there's absolutely no blood, no oxygen going downstream. Aortic stenosis, aortic ectasia, aortolith. Again, aorta, largest artery in your body, and it's connected directly into your left ventricle of your heart. Oh, excuse me. Okay, embolus, ischemia. Emia is blood condition of isch. Isch means not necessarily occlusion, but yeah, it could mean occlusion. It's blocking the blood flow, and that's what a thrombus and an embolus can do to something. It can cause ischemia. Right? Fleb, we already talked about veno, X-ray, right? Angiogram, aortogram. Um, uh, Another slang for X-ray that we saw is in previous quizzes was film, right? If you have a chest X-ray, that's a CXR. You could have PA or AP view, posterior anterior view, which is from the back to the front, or anterior posterior view, which is from the front to the back. Angioscope, vascular endoscopy. Where are we visually looking at? I am the process of visually looking at what? Endo, which is the insides. Sonogram, that's what? That's an echo or a 2D echo. Transesophageal, what am I doing? I'm putting a tube trans across your esophagus, which is your food tube. Systolic and diastolic pressure. Systole is when the heart is beating at the top of the cycle, and diastole is when the heart is recharging, resetting for that next contraction. Cardiology, cardiologist, phlebology, phlebobologist. Phlebology, those are techs. Phlebotomist, also another tech. The blockage, we can carditis, angiocarditis, endocarditis. We saw this before. Oh, someone awake. Like a student is awake, excuse me. I got distracted from an alert on my phone. Congestive cardiomyopathy or dilated cardiomyopathy. Remember, there's not a lot of room there to have dilatation or congestion of your heart. Hypertrophic cardiomyopathy, most common, left ventricular. If it's right, it's most likely a pulmonary problem or ARI pertaining to your pulmo or lungs. ASD, VSD, CHF, MI, we know those. Cardio and aneurysm. What's an aneurysm? It's when a blood vessel has a weakness of its blood vessel wall and then it bulges out and it could pop. If it's in a large blood vessel, it's going to cause massive problems like a stroke. But if it's in a small blood vessel, it might cause some localized ecchymosis or damage. But aortic aneurysm, you have that, you're not going to make it out of the room. It's really bad news. Aortic regurg. Re means to go back. Regurgitation is when the blood flows in the wrong direction, right? So it goes aortic regurg. The aorta is supposed to take the blood traveling out to the systemic circulation, which is the rest of their body. But every once in a while, especially if the valve is compromised, your aortic valve, it's going to flow back into it and cause regurg. These you can figure out just holding there for you to analyze them. Hypertension, hypotension, normal tension, or eutensive. If you're hypertensive, of course, too much blood pressure. And how do we measure it? We measure it through this machine called the sphygmomanometer. Angina, arrhythmia, we already went through that. Something that's congenital. Al pertaining to, con means with, it's a prefix that means with, genito, or genit means to be born. So congenital heart defects are pertaining to things that happen when or with your birth. I could give you anti-anginal pain, and the most common is nitroglycerin. That's the little white pill that you put underneath your tongue if you have that problem. Antihypertensive, very common, beta blockers, alpha blockers, you may have heard of those. Vasopressor, vasoconstrictor, it's something that will press on or constrict or uh, um, make your blood pressure higher. So if you have very low blood pressure, right, or hypotension, I give you a vasopressor to put to kick up your blood pressure. Cardiatonic. Tone means strength, right? Our strength of contraction. We're not only looking at the heart for its strength of contraction, we're also looking at its timing. Because remember, arrhythmia is not a good thing. Cabbage, coronary artery bypass graft. This is the best one out of all these and the most common. Valvectomy, valvotomy, valvuloplasty. We know all of those because of the suffixes, but this is to do with valves. This is to do with the heart itself, cardio, heart, ventricular, heart. CPR is cardiopulmonary resuscitation. So it not only deals with the heart part, it also deals with the lung part as well. Pericardiocentesis, remember my truck driver story? It's always a truck driver story. Centesis means surgical puncture of surrounding what? Your heart. Nowadays, it's ultrasound guided. Man, when I did it, it was not. Angiography, raphy means suture. Suture of my blood vessel, suture of my aorta, suture of my arterial or my arteries. And here's some abbreviations. AFib is atrial fibrillation. VFib is ventricular fibrillation. NSR stands for normal sinus rhythm. It means if everything on your EKG or your electrocardiogram is normal. I don't know what SCA is. MVP is mitral valve prolapse. ASD is atrial septal defect. VSD is ventricular septal defect. CO is cardiac output. SV is stroke volume. Nice. There's a nice little formula between this and blood pressure that you future clinicians / nurses will be looking at. Echo means more of a sonogram. The EKG and the other ones, I don't know what those are. Well, actually, CTA is computerized tomography or computerized arteriogram. MRI is magnetic resonance angiogram. And we talked about those before. CHF, congestive heart failure. MI, myocardial infarction. CAD is coronary artery disease. And of course, cabbage, coronary artery bypass graft. BP is blood pressure. We mentioned MRI, DVT, deep venous thrombosis. And the funny thing about this one, HTN, is that's hypertension. Typically, it's written HPN lowercase, but things could change. So that concludes our quick review. And again, I may have mentioned it in the other video. No questions this week on just chapter 8 and 9 because we're going to be doing exercise in class to bolster your memory and bolster, do something kinesthetic with, like writing things down. Okay, with that being said, thank you very much for joining the show. And I will see you guys in about 3 hours.